or more than 3 attacks every month, then it is better to start prophylaxis. So in prophylaxis, whatever combination of drugs you use, success rate is almost up to 50%. And FDA drug approved drugs are only few, like propranolol, timolol, sodium valproate, and topiramate. I'm going to discuss each medicines in future slides. So when do you call the treatment is successful? If patient's frequency of attacks reduced less than 50% within 3 months of period time, the treatment is successful. And minimum how many days trial should be there? 8 weeks trial with one drug before changing to any other drug. Means if you started one medicine, like for example propranolol, don't change if the frequency of headaches not going within 3 weeks, 8 weeks. Like minimum 8 weeks of trial is needed. And every time prophylaxis treatment, it should go for 6 months. And in these 6 months also, particularly for the few medicines, last 2 weeks you should taper slowly the dosage, then stop. And this migraine prophylaxis treatment means generally usually only 1 tablet or 2 times daily treatment you will take. And to start seeing the effect, it will take minimum 2 weeks or 2 to 12 weeks to start seeing any effect. And apart from FDA approved drugs, there are some other drugs which are seen clinically effective, some studies, but not yet approved in the FDA. And that most commonly used is this flunarizine, amitriptyline, nortriptyline, phenelzine, cyproheptadine is also used. And now new drug has come, that is a monoclonal antibody to CGRP receptor, that is erinumab. And there are some other antibodies to some specific proteins also, and these are just only once in a month injections. These are used particularly if there are a lot of side effects with other drugs and patient can't tolerate this, you can use this. The safety profile is well, and it is almost about to come to the market. So first let us discuss about the most commonly prescribed, particularly in Indian subcontinent, the medicine for prophylaxis, that is flunarizine. Verapamil also calcium channel blocker, but flunarizine is most commonly, and commercially it is brand name as Cybelium. Before starting any medicines, even if you are not a doctor also, definitely you should know the side effects of the medicines or the contraindications of the medications. And side effects means the effects which can be tolerated but still patient can take. Contraindication means never give that. If you give, harm is more than a benefit. The contraindicated flunarizine is contraindicated in depression, Parkinson's disease, or extrapyramidal side effects, in acute porphyria, GI obstruction, or urinary tract obstruction. And this is, as I said, particularly in Indian subcontinent, this is first choice of prophylaxis, and this is also first choice in women of childbearing age because it is FDA category C. So many other drugs. One important thing I want to tell that almost all type of prophylaxis drugs for the migraine which is taken, you should always remember that one of the most common side effect is weight gain. Most of these drugs, they cause weight gain in those individuals. See, most commonly we see migraine in childbearing ladies. If you give any other medicines which have got side effect to the babies, that are not safe. That is also one of the reason, even clinically also most commonly used this Cybelium. Category C, it is FDA category C. So this is one of the good option. So what it does, flunarizine, it acts by cerebroselective calcium channel blocker. And how it affects in the migraine, so it reduces intracellular calcium overload due to the brain hypoxia. Again, as I said, this sedation, constipation, and weight gain is the side effect. So you should start one small tablet 10 mg daily in the night, particularly in the patients less than 65 years. If the patient is more than 65 years, 5 mg you can give. And initially you try to prescribe for 2 months and you will see the difference. If there is no difference, you should stop. If there is no difference, even until 2 months. And generally the maintenance dose is given like 5 days a week, Saturday Sunday off, no tablet, like that. And the course is for 6 months. After that you stop it. Again, if the patient is getting again migraine attack, then again you can start for another 6 months. After that, the first common tablet used for prophylaxis is propranolol. And propranolol is in a patient those who are having migraine, plus they are also having other medicine problems with the tremors, anxiety, panic attack, and we should also see the BP. BP also should be normal. If the patient's BP is low, you cannot use this. So again, the tablet you can take with or with the capsule you can take with or without food, and tablet on empty stomach only. So these beta blockers are not recommended in patients with more than 60 years of age and smokers. Among beta blockers, 3 have been shown in preventing migraines: propranolol, metoprolol, and timolol. Propranolol is most commonly prescribed. This is first-line agent, and again FDA category like flunarizine, but this has got lot of other side effects, like you cannot take when the patient is having asthma attack or cardiac problems or other things. Okay, so in this part initially 40 mg 2 times daily will start, and you can go up to 80 to 160 mg. And the contraindication is, as I said, mainly here the bronchial asthma, bradycardia, cardiogenic shock, low BP. I said if we should see always before starting this medicine. If BP is normal or higher side, then only you can start this. And pheochromocytopenia, heart failure is also seen. So one more common tablet which is used to FDA first line according to the American this thing and the standard prescription for prophylaxis even in the Gulf countries, that is topiramate. But valproic and dialprox sodium also has shown, but topiramate is standard. But this is category D. It means never give any woman with the childbearing age, because it can have lot of side effects for the infants. And it is recommended as a first line prophylactic agent for a chronic migraine. And initially you should start 25 mg once in a night for 1 week, then slowly increased at weekly interval, and the usual dose is usually 50 to 100 milligram per day in 2 divided doses. So they are indicated particularly in patients refractory to other drugs or when propranolol is contraindicated. And the contraindication for these medicines, particularly this topiramate, is if patient has taken alcohol in less than 6 hours of age, or patient is generally alcoholic, don't give this. Patient with metabolic acidosis, on metformin, and even of course pregnancy, as I told, it is category D. There is one more tablet is called divalproic sodium, also sodium valproate in this category. Here one of the side effects is alopecia, curling of hair, weight gain is seen in almost all, increased bleeding tendency also. The contraindication for these tablets is pre-existing liver diseases, porphyria, urea cycle disorders. So for prophylaxis, initially 250 mg BD will start, and then slowly you can increase to 500 mg BD. And anorexia, vomiting, loose motions, and heartburns are general common side effect. But one severe side effect is fulminant hepatitis. It caused particularly in the children below 3 years, where suddenly patients will have a sudden liver failure. One more class of the drugs, antidepressants, most commonly used is this amitriptyline, marketed in trade name as a Triptomar. So many other brands are there. So if patient is having a migraine attacks, plus if they are also having either depression or insomnia, then you use this amitriptyline. So this is also among the first line medicine used for chronic migraine prophylaxis. And prophylaxis of migraine in these things initially start 10 mg, even though patient may need 1 mg per milligram per kg body weight, but generally these people, they tolerate 10 mg only. In lot of cases it has seen that it has reduced migraine attack as well as coped up with the insomnia problem also. The contraindication mainly here is recent MI, arrhythmia, coronary artery insufficiency, and it should not be given in less than 6 years also. As I told, one more, the new drug has come. This is calcitonin gene related peptide antagonist, and the most common here is the erinumab. You will get this as a subcutaneous injection. This is a human monoclonal antibody that acts by binding to and inhibiting CGRP receptor or ligand. So this subcutaneous is same like insulin, it is given. Even you will get a sometimes needle free device also, and this is just only once in a month. So initially only 70 mg is given, but you can adjust almost up to 140. So particularly this is indicated if all other drugs either side effect or drugs are not useful, then you use it. So one more is bizotrefin. This is not used generally nowadays. It's almost, so I'm not discussing much in that. But even the cluster headache, even in the migraine also it is used. So there is one more. Next is botulinum injection. This is off-label medicine, not FDA approved, but if you give botulinum injections, particularly in the sides of the head where the patient is frequently getting in that side migraine attacks, it is given approximately every 2 weeks, multiple injections around the head and neck. Generally it is seen that it is reducing the severity of migraine attack. And some like coenzyme Q10 tablets, capsules also you will get commercially. These are generally no evidence, but because they are safe, they have been prescribed frequently. And I want to talk here about some